morning, guys. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy. If you are in Philippines, good morning. If you are in United States of America, good evening. So every Thursday, we highlight innovators, academicians, physical therapists, and clinicians. So it's me again, Dr. Jenny Yusuf. I'm a physical therapist, doctor of physical therapy, and a board-certified geriatric clinical specialist. I'm the founder of Balance and Fall Support Group in Aging Adults, and also the state advocate in Delaware for geriatrics. So I would love to introduce to you our not innovator, our highlights for tonight for the Thanks God It's Thursday. So we have an academician. So we have Dr. Jerald Mendoza. Dr. J, they call him. And for me, he's my professor back in Far Eastern University, Dr. Nicanor Reyes Medical Foundation, where I graduated for my bachelor's degree in Philippines. So we call him Doc J right now because he is a doctor of physical therapy and now a dean of the Daniel Mercado Memorial College Institute of Health and Sciences. Before he became the dean, he worked here in New York, and he is a doctor of physical therapy for 15 years in outpatient clinics. So he's a New York licensed physical therapist. So without further ado, welcome Dr. J. How are you?
Hello, how are you, Dr. Jenny? So I'm good.
Uh,
I'm good. It's early morning here in the Philippines, and I see that it's
um,
pretty much almost late night there in the East Coast, right?
yes,
So thank you
yes.
so much for that very good introduction.
Thank you. You're welcome. So do you miss East Coast?
Of course, I miss the East Coast, the convenience, the good infrastructure, of course. And
Yeah,
also,
yeah.
I love to go hiking on the weekends, so it's very convenient to go a lot of other outdoor places and hiking places, especially up north in New York. Okay, and
Mhm.
also southern part. Okay, like in Delaware and Pennsylvania. So it's
Yeah.
really good. I'm missing those. Of course, the weather, the
Yes.
four seasons. Like
Yeah.
here in the Philippines, we only have the wet and dry season. So
Mhm, mhm.
I really miss the four season, the snow, of course, but not the part wherein you have to shovel.
Exactly right. So with my introduction, Doc J, did I miss anything? I know you're the dean right now of the Daniel Mercado Memorial College of Institute. To tell us more about what is Daniel Mercado Institute, what comprised like it's a medtech, physical therapy, allied health, something like that, Doc J.
Yes, okay. Daniel Mercado Memorial College Institute of Health and Sciences is actually here in Batangas, in the western part of Batangas, Philippines. Actually, it's a small college. Actually, it's a small college here in Tanawan, and I'm actually the dean now of the School of Allied Medicine, which actually comprises of the School of Medical Technology, Radiologic Technology, Physical Therapy, and Psychology. So we have a few students here to start with, and this is actually like a new college. That's why we're still like picking up when it comes to the number of students. Yeah.
Yeah. So why did you come back, Doc J? So why you went back to educating? I know you're our professor in our bachelor's in science. Then you became a clinical, like a physical therapist, of course, outpatient. Now you're coming back as an educator. So what is the passion going on?
Okay, so I feel like I get tired with the rat race every day, especially in the Northeast, especially in New York. Every day you have to like do beat the hustle and bustle of the city. But I live and work on Long Island back then, so it's not as bad as if you work in the city itself. So I guess I came back here primarily because I love to teach. I guess that's my passion. That's my calling. That's
Yeah.
why they said, it's like my vocation. It's not actually a work for. It's like a vocation. That's why vocation comes from a Latin term, which means from a Latin term vocare, which is like to call. So I feel like this is my calling. So I came from a family of educators, and I guess for what I have learned there in the United States, I guess um, it's actually time to give back to the students here. Now they will have like a different perspective. They are being taught by someone who will be in the future. I call the United States as the future of physical therapy practice, because if you're going to compare it with the practice back home here in the Philippines, it's so different. Here you have to improvise a lot. Okay, not like in the United States, you have all the resources you could possibly have. So I mean, it's good for them because they are listening now to a person who actually have experienced the future. That I would say that. And instead of just like a professor who's just like telling you things because they have watched it in YouTube, because they haven't been to the United States or to any Western countries to practice physical therapy.
Wow. Yeah. So how about any your wins or any challenges now that you're back in as an educator? So it's a different setting, especially compared when you were in a clinical setting. So what will be
Well,
the
for the
challenges now?
challenges, I'm sorry.
Mhm.
So for challenges in like now, I mean, as compared to being in the United States, one of the challenges like I have a lot of visions for the school. But the problem is like, the lack of resources, financial resources. So you have to be very good with improvisation when it comes to like for laboratory, for example. Like since this is a new college, I mean, I guess they have laws on those schools. If you're going to provide a cadaver for dissection, not like before we have cadavers in our laboratory. So here we actually work on models. Okay, and now for them to have a real feel of how the brain will look like, I will actually use a cow's brain. Okay, so they could actually look at it and feel like, oh, how does a fixed brain looks like in the laboratory? So when they maybe pursue medicine, at least it will not be strange. It will not be strange to them, like looking at the specimen instead of, if you look at the model, of course, this is a perfect model. All the veins, the arteries, the nerves are shown. Okay, but if you're gonna look at an unfixed brain, for example, an unfixed anatomical specimen, it's a different thing. So you really have to like go through it and learn which nerves, veins, or arteries are you're actually looking at. So that's one caveat of working in a newer college, and maybe it's also an experience by other professors in smaller colleges. And one thing is the internet. Okay, so we know that we are very tech savvy as a Filipino, as Filipinos, I would say, but the internet service here is actually lagging behind other Asian countries. We're still like the internet infrastructure is still like a little slow as compared, of course, to the United States. But this is what we have, so I guess you have to make use of it. So, and also for the wins, I guess seeing because I used to teach before, right? You are one of my students back then in FEU,
Yes.
and the wins is like seeing you guys actually excel in your field of expertise. Like you are a specialist in geriatrics now. I've seen your batchmates like Ponzi and Ben being entrepreneurs at the same time clinicians. So I am very happy to see you guys like success. That's why even for my students nowadays, I've been telling them, I don't want you to be like me. Or, I don't want you to be like my equal. I want you to be better than me, because
Yeah.
that would be my what do you call this? I would be happier if I will see you like doing good in the profession that you actually chose, in the profession that you actually put forth all your knowledge, sweat, and tears. So that's one thing that I actually like keep on telling them. Okay, just be good on what you do.
Yeah, I
Yeah,
think that will be your legacy, knowing that, oh, these are my students and they
yeah.
excel,
So
something like
that's
that.
why every time I see you guys in your profile on social media and all that, being this and that, I was like, oh my God, that just gave me like, it's like, wow, this, imagine these students back then and now. I'm so happy for what you have been, what you have become actually as a
Yeah.
professional physical therapist. And not only physical therapists, I've seen people who are like doctors now, neurologists, orthopedic surgeons, and also nurses, entrepreneurs. So those are, you know, um, and I know I I don't know if you remember, just one student actually. She's a physical therapy student, but now she's like one of the like chief officer here in the land transportation. She works in the government now, so it's
Oh,
so
that's
different.
nice.
Yeah,
Yeah.
exactly. And she said that, all the things that she learned from college is like the values that we have instilled in them. It's like she's been using that in her office as a public servant, like in the land transportation office here in the Philippines. Yeah.
Yes,
So
you are one of our instruments because you mold us. Of course, that's our stepping stool. Imagine college, and then we will be outside, and then we'll never know that we'll be in US, right? So I went to United Arab Emirates and Saudi Arabia first, so I'll never know that I will be in America. So that's really, you mold us and your discipline. Speaking of that, what will be the best characteristic of an academician, knowing that you will be in an academe? So what you need to have to be more
Well, I
effective?
guess it's a lot of patience. And you have to be flexible because teaching you guys is so different from the students nowadays. You guys are very motivated and you have less distraction as compared to the students nowadays. Now, social media is everywhere, they can
Yes.
use phones, everywhere. So you have to really be patient and very flexible when it comes to like the students. Remember, the students are so different back then and now. Like you guys, even if we don't hold like a material, a visual aid, and I will tell you like to imagine this and that, you'll be able to do it. But right now, the students are visual learners. They are more kinesthetic learners nowadays. So you have to have a very good visual aids in order for them to actually absorb the topic that you want them to learn from. Okay, so that's one thing that's actually um, is different from back then and now. Okay,
Yeah,
so
that's true. That's another challenge then. Especially nowadays, how about those philosophy in life that you want to instill with us or remind us? Or any courses that you think will be very valuable for us clinicians and also some of the therapists who wants to be in an academe. So do you have any specific courses or books that might be helpful for them, Doc J?
okay, so for my philosophy in life, I guess it's like never stand still. Okay, this is also the same motto of my alma mater, which is Utica University in Utica, New York. That's where I graduated from and got my doctorate degree in physical therapy. So I believe that as a physical therapist, it is our duty to keep on learning and keep ourselves abreast with the current trends in our profession that are backed up by evidence to improve our patients' experience. I'm always an advocate of continuous learning. So if you're going to be in the academe, you cannot stop learning every day, especially with physical therapy, which is very dynamic as a profession. We have to be involved in research. Okay, that is one thing. Okay, because the knowledge will stop if these researchers stop actually doing what they're doing. So it is very important for us to keep as abreast with the current trends, as I mentioned earlier, especially being a member of the APTA, the American Physical Therapy Association, and also the journals that they actually publish, like the JOS PT or the Journal of for Physical Therapy, and also to keep me updated. Even that, I mean, reading that and always going through online resources for physical therapy, like the database Pedro. I guess if you're not
Yes, yes.
if you're aware of that, actually, even if I'm here in the Philippines, I keep on like reading on that online to actually keep me updated with my knowledge in physical therapy. Yeah.
That's really good tips there. And speaking of that, how about you're very active right now. You're still very fit. I said that you didn't even age well. So
Oh,
what keeps
thank
you
you.
moving? It's different than the physical, like what keeps you moving are active, but what keeps you moving?
Well, now I was a dean of physical therapy. So I mean, students are central to my mission as a dean of allied medicine, and which is not just physical therapy. So I told you it's like med tech, or that is equivalent to the medical laboratory scientists there in the United States. And also I have psychology under me, radiologic technology, and of course physical therapy. So These students actually rely on us as administrators, as a dean of the SAM, as we call it, School of Allied Medicine, because their education, their growth, and success are my top priorities. I am committed to ensuring that all these students also receive their high quality education, of course, practical training, and the support that they need in order to excel in their fields. I am also responsible for, curriculum development and oversight, facility development and accreditation, and compliance, community and industry engagement on top of my administrative duties. Believe me, my day is always packed, and you never know what's going to happen during the day. That's why I always believe in this quote, like that quote, like which says, when we plan, God laughs. Because every day you don't know. You have this plan, and then it will just change otherwise
Oh,
because of
God
the
laughs because we
yeah.
never keep planning. Okay.
that's
Didn't
that's
know
what I'm
that.
saying. When I actually like go to the office and all that. So I have this set of plans for the day, and then the secretaries of different departments will just tell me, okay, you have a meeting, this and that, which is actually sometimes are unannounced or surprise. So yeah, that's what keeps me moving. And also, of course, my family. My family is here with me, and for you to be, to be a good provider to them, you have to be physically fit as well. So
Yes,
yeah, you have
yes.
to keep on moving, go to the gym, exercise. Exercise. That's very important. Physical activity. We're teaching that to our patients, and I guess we should be the ambassadors of that.
Yes,
Yeah,
exactly. Our model. Speaking of
exactly.
exercise, we are here. The Balance and Fall support groups are listening. We also have our clinicians and caregivers. This will be featured in YouTube so that everyone can hear. So, as a physical therapist, Dr. J, what will be your tips for our Balance and Falls aging adult members and just to make them fit and decrease falls, risk of falls?
Yeah, so one of the best tips for aging adults to improve balance and prevent falls is to regularly engage in exercises. So already like 49 years old. So I guess I have to, yes, say I'm close to 50. So I guess this is one tip that I should be looking into. Okay. So yeah, again, to prevent falls is to regularly engage in exercises that enhance strength, balance, and flexibility. Activities like Tai Chi, your yoga, and balance training exercises can significantly improve stability and coordination. Additionally, ensuring safe home environment, which is very crucial, by removing tripping hazards, all those loose rags on the floor, we have to like avoid them and actually not place them in the areas where our adult member of the family or elderly member of the family are actually usually going to, like the kitchen, the bathrooms as well. We can also install like grab bars in key areas like the bathroom, and ensuring good lighting which could further actually reduce the risk of falls. That's why they're telling it's not the weakness, it's not actually the balance problem sometimes that actually leads to fall. It's actually the poor vision. That is because of the lighting sometimes. Sometimes it's just, I'm just going to go to the kitchen and grab some jam or some cookies and all that. But that's why I didn't turn on the light. That's why they fell. Sometimes we just take that for granted. But that is very important for us to actually minimize falls among our elderly. Also, regular checkups with the healthcare providers to assess vision, the medications, which could also affect the balance of our adult population, because some of them have comorbidities, and also maybe they have like they're polypharmacy. Yeah, sometimes they're taking one
Yes,
medication after another,
exactly.
and that could cause like lightheadedness or dizzy spells sometimes. And of course, the overall health has to be taken into consideration, which is very crucial in maintaining balance and preventing falls. So we as physical therapists are highly trained to actually help the aging population. I actually enumerated some of the major things that we physical therapists are capable of. That first, we can design actually personalized exercise program, okay, that could focus on strength, flexibility, and balance, which may include activities like standing on one leg, heel to toe walking, for example, or leg lifts. Okay. Secondly, exercises that could mimic daily activities help improve coordination and confidence in performing everyday tasks safely. Or like this is what we call the functional training programs that we are very good at. Thirdly, PTs like us should work on improving walking patterns of this elderly population, including the speed, the stride, the stability, and often using assistive devices if necessary. Okay. Moreover, in some cases of imbalance, sometimes we have to consider that this is not just aging sometimes. It could be inner ear problems, okay? So
Yes.
we have to roll this out just to make sure that the cause is not because of aging. And in such cases, we have to incorporate specific exercises to address vestibular system dysfunction. And lastly, but most importantly, education, education, and education in fall prevention. I'm a firm believer that an educated patient is an empowered patient. We have to engage our patients in their own healthcare journey. Okay, we as PTs can provide guidance on fall prevention strategies such as home safety modifications and proper footwear as well. So that's actually the things that I could give our elderly populations and also the caregiver and the family members of this specific special population. So
That's
yeah,
amazing. Yeah. As if you already itemize all one journal about fall prevention, Doc J. I'm just like a patient having a telehealth from you. You're like a
yeah,
really
I know that this.
educator.
Yeah, I know that this podcast is going to be very limited, so I have to like write them down, and so it's going to be easier for you and me as well. So
Yeah, yeah. I'm just like a patient on the other line, and then you're educating me. Oh, Jen, you should not be fix your home modification, turn on your lights. Okay,
yeah,
okay.
try to avoid clutters.
Yes, exactly. And those are some of the tips, wonderful tips from CDC. Lots of resources out there, guys. So you really need to check on your state. There will be some free brochures. So it's really September is coming, fall prevention month. So that's really very, very great tips, Dr. J. So what are the things that we don't know about you, Doc J? So we can see now,
Well,
I remember you went to Saudi Arabia, or I don't know what Middle East you went before. So I know you are our educator, but what are the things that is unique from you
well,
that we
after
don't know?
teaching for 5 years or 6 years in FEU, you guys were my students back then. I actually looked for greener pasture in the Middle East, actually in Saudi Arabia, for a number of years. And after that, I applied to work in the United States, and then in New York specifically. So I was there for 15 years, actually. Yeah, as you have mentioned earlier. So I've been there 15 years as a supervisor, actually, in an
Wow.
outpatient facility. This is mainly orthopedic and sports cases, but geriatric cases is not uncommon. So
Yes.
yeah, and also I'm a polyglot since I'm I've been to a lot of cultures, so I can speak and understand Filipino, of course. Yeah, it's where we
Uh-huh.
were born.
Arabic. How about Arabic? Right?
Arabic also. Yeah, yes, I'm fluent in Arabic, but it's getting rusty right now because I'm not able to practice it. And also Spanish. Spanish is like
Hmm.
because when I believe that when you're working in New York and especially in those states wherein you have a lot of Spanish immigrants, it is very important to learn the language because I guess I have trust issues because in the first 2 months of my being a physical therapist in New York, I always have this interpreter with me.
Mhm.
Okay, so I have this like interpreter who's actually trying to like translate the what the patient's trying to say during my initial evaluation,
Mhm.
but I feel like I don't trust them so much. It seems like they're not translating it very well. So I told myself, oh no, I have to learn this and I have to communicate with them very well. And also they appreciate that if you are speaking their language, because
Yes.
for them that's their mother tongue. So it's they appreciate it more, and you feel like you're speaking to their heart, and you're speaking to the whole person instead of just like speaking in English to them. Okay, I understand we have to speak English when you're in the United States, but some people are not capable of, and you have to understand that. Yeah.
Yes, that's true. I remember when I was in Saudi Arabia, I keep saying Aywa, Aywa. So I thought it's yes, right? And then I didn't
Yes.
understand what the mother is telling me. So I didn't know that she wants me to look after her daughter sitting on the chair because
Oh,
she's going now to the cubicle. And then I said, oh, yes, yes. And I
I
didn't know that
was.
that's what she meant. And then I
So,
really thought that it's differently that I thought she's saying that if it's okay for me to bring my child or to be the child to be here. So I said
uh-huh.
yes. I didn't know that she meant like look after my child because I will go now to the cubicle. And I'm a physical therapist, so I need to go to other patients' room too. And then she was upset because I was not there, but the child's still there, but I was not there
Okay.
beside her, something like that. And then I told to myself, I really need to learn this thing. I keep
Exactly. It's
saying
very
things that
important to learn.
new.
Yeah.
Mm-hmm.
To learn those languages is those that also will add up to your, to your credentials. It's good when you're when you can speak other languages. It broadens your horizon.
Yes, yes, that's true. And I like when you said, Doc J, that it is like there's a bond, there's a communication that you're the effort that you want to learn their culture, their language is a big plus. And there's like you become close already to that patient because you're trying your best. And they're laughing because they know that it's not straight. It's very close, but they
Yeah.
understand what you're talking about. So the effort is there and they appreciate that, right?
Yes. Yes, of
Yes,
course,
so
of
they
course.
know you're
That is
trying.
very important. The only thing I usually ask for these people who are native speakers of a certain language, they don't correct us sometimes if it's like they just try to understand us and
Yes.
not give us the correct way of saying it. That's why
Mhm.
I was like, I hope they will do like they will have the audacity or maybe to actually correct us and tell
Yes.
us like, oh, this is how you say it.
Mhm.
Well,
Some,
maybe because
some,
they're scared that they may offend us or something,
yes, that's
and then
true.
they
And
just
then
stop.
I think they're enjoying that we're wrong.
Yes, exactly. Especially the pronunciation in Arabic, it's so different. They have
Yeah.
different phonetics, so it's really hard to actually learn it from the beginning. Especially the alphabets are so different. Like
Yes,
the T can be pronounced differently, like T, ta,
that's true.
tha, da. I
Yes,
mean, it's
yes.
really hard.
That's amazing. So they know that I came from Saudi Arabia when I work in Abu Dhabi. They know I thought that all the Arabic will be the same. And then when I say a certain term and I know that it's the same and then said, did you work in Saudi Arabia? That is Saudi word. It's not from here. It's not local. Oh, really? But that's almost the same meaning, but they call it differently. And then my husband also
Oh,
correcting me
okay.
sometimes. Oh, we don't say that. We say this. I said, for me, you are all the same. And he always correct me. No, no, no.
Exactly. Just
Yeah.
like here in New York. Oh, I mean, they was like, oh, that's a Central American word. That's from El Salvador. And I was like, oh, I'm from Chile. And then we don't say this. I'm from Venezuela. I'm from like Colombia. This is how we say it and not like that. So it's pretty much like there's a little difference in between cultures, but it's good to know. It's good to know. And
That's
for me,
true.
it's not like a negative thing. For me, it's like a plus thing that, oh, yeah. So
That's
there are
true.
differences, even if they are actually speaking the same Spanish. Yeah,
It's very true because right now in Indeed, if you can see, bilingual is a plus. You can
of
really
course.
see the
Yes.
Spanish and then
Yes.
they highlights that bilingual and then speaks bilingual. They is a plus, but it's not a must. Something like that. It's really good.
Yes. Uh-huh.
Yeah. So
And
I
it's also a good thing about us Filipinos because I guess our tongue is very flexible. If you would put it that way, like if we only learn like a language, a certain language like seriously, we will actually be able to like actually speak it like a native speaker. I mean, I guess that's one good thing about our Filipino-ness, I would say.
Yes, yes. I believe so. Filipinos all over, just like my cousin, he's from Japan and he's very fluent in Nihongo. So he
Yes.
is, because we are very good in English, so now he is an English translator. And because he is very good
Oh,
in Nihongo, so he can
yes.
translate both for the tourists and for the business. So he's a vice president
Mhm.
of big company and in Japan and then brought to Philippines. So now he speaks and represents the Japanese. So he's a Nihongo. So
Oh,
we're all
that's really
over.
good.
So that's good.
Yes,
That's
agree.
amazing, polyglot. I hope and I learn more words. So thank you so much, Doc J. So how can we
You're very
connect with
welcome.
you? So if
Actually,
we are want to learn more from you.
well, I have an email. Maybe you
Mhm.
can post this here on
Yes.
this podcast below. And also, I have a Facebook. You can also I'm giving you the permission to actually post it, so our listeners or viewers can actually connect with me. Okay. And thank you
Yes.
so much for this opportunity.
You are welcome. Thank you so much for this opportunity. You're just telling what's your
Thank you so much,
day,
Dr. Jen.
and then that's a lot of responsibilities. And I am grateful that you squeeze us on your time. So, congratulations, Doc J. Thank you
Thank you
for
so much,
your
Dr. Jenny.
leadership. Thank you for educating us. We always value you guys as our educator because you're top of, we are not here if we are not a good student, we have a good professor, right? So the discipline, the culture there, of course, the knowledge that you shared from us. I remember you teach us like, you taught the subject part of the electrotherapy too, right? The
Uh-huh.
electrotherapy and things like that.
Yes.
So with Sir EJ. So thank you so much for everything and God bless. Do you have a closing remark for our listeners?
Well, not really. That's what I always keep on saying. Yeah, just keep on learning.
Yes.
That's the advice that I could give everyone. This is good for the students and of course the professionals alike. Keep on learning. Do not stop learning. Okay. Yeah,
Amen.
that's it.
So guys, you heard Doc J. If you want to connect with him, I will post his email and then definitely ask more questions. And if you want to check, if you want to be an academician, because we're all clinicians right now, but you feel that you have a passion and calling to be an educator, definitely he will give you some tips. So it's me again, Doc Jenny, physical therapist and doctor of physical therapist. I hope you learned something from our interview today with Doc J, and then just connect. And also what he told us, keep learning. Education is, you just always advance your skill set, so even you are a clinicians or not, your patients are your students. As a physical therapist, you're the educator there. You can be a coach, you can be a teacher. Just right now,
Exactly.
he's a physical therapist, but he's educator right now talking to me on fall prevention, and I'm the student and the patient. So same thing with you guys. And any setting you are, just be best of what you can be. All right. So thank you guys. Thank you, Doc J. God bless you more.
Thank you so much, Dr. Jenny. See you
You're
soon.
welcome.